Health Check with Nurse Jen is presented by Island Cancer Center.
Hafa-day, I'm Nurse Jen and you're watching Health Check. Athletes beware. If you play a sport that requires repetitive overhead, overhand extremity movements that cause strain and stress to the elbow, then you may be at risk for an ulnar collateral ligament injury, also known as UCL. The UCL is a thick triangular band located on the inner half of your elbow. And if your elbows are in pain, it may be because your UCL is frayed, has a tear, is stretched out, or even worse, is ruptured. Elbow injuries can really throw a curveball in your game, and it's even worse if your elbow injury is torn or ruptured because it will usually result in a surgical referral. But baseball pitchers aren't the only athletes susceptible to a UCL injury. It can also affect golfers, tennis players, quarterbacks, and volleyball players that love to spike the ball. The act of throwing overhand or spiking produces a force at the elbow that can exceed the limits of the UCL's strength. Over time, this repetitive stress can irritate the UCL and its surrounding muscles and tendons, and ultimately swelling occurs, sometimes with numbness, down to your forearms and into your fingers. Bottom line, if you participate in any sports that requires repetitive upper arm movements that cause strain or stress to the elbow, then you're at risk. Interventions include maybe wearing a sling, a splint, or a cast for about 2 to 4 weeks while your elbow heals. Depending on how badly it's sprained, you may need physical therapy to learn proper stretching and strengthening exercises. But if these options don't work, you may be referred to the Tommy John surgery. This is an ulnar collateral ligament reconstruction surgery. It's a graft procedure where the UCL in the medial elbow is replaced with a tendon from another tendon elsewhere in your body or from a non-living donor. The alternate tendon is often from your forearm, your handsprings, or your foot. Complete recovery post-op can take anywhere from 18 to 24 months, but you should be able to go back to the game after full recovery. I hope to see you next week, same place, same channel. I'm Jenn Artero, registered nurse, reminding you, don't wreck yourself, health check yourself.
Health Check with Nurse Jen is presented by Island Cancer Center.